And I would like to introduce Pushpa Kaura, who will introduce our speaker for today. Thank you, everyone.
Thank you, everyone, for hanging in there. Today's speaker, this is the last talk of this series on integrative medicine. And today our speaker is Kyle Roberts. He's a trained Ayurvedic practitioner, which Ayurveda, you might recall from an earlier lecture, is the traditional method of Indian medicine. So Kyle is a practitioner of Ayurveda, but he's also a student of Chinese medicine at the Dragon Prizes College of Oriental Medicine here at Gainesville. His work is primarily directed towards addressing individual health concerns, as well as teaching various methods for improving one's well-being. He incorporates acupuncture, herbalism, and nutrition in ways that make healthcare goals simple and achievable. Both acupuncture and herbal medicine have been used for thousands of years. And what is its relevance in today's society? So today, Kyle will talk on the foundations of Chinese medicine and why it serves as a superb benefit for many health-related concerns. Thank you, Kyle, for doing this.
Thank you, Pushpa. I appreciate that introduction. Very lovely. Lovely to meet everybody via Zoom. And I hope everybody's been doing well and healthy and strong during this unique time. It definitely is something that will be recognized in our history for many ages to come. So I think the topic of medicine, the topic of healing and well-being, it couldn't be higher on the list of important things to discuss and explore than right now. So my background, as Pushpa said, is in Ayurvedic medicine. I come from Florida, born and raised. My grandparents, my great-grandparents, my great-great-grandparents, and the parents of them all came from Florida. So I always thought it was very ironic that I somehow got into the path of Eastern medicine. Growing up in such a Florida atmosphere. But the sciences of the East attracted me, and I thought that the healing methods of the East were very unique. It was more, how could I say, there was patterns rather than strict science. It was more imaginative rather than a precise measurement. And my goal was never just to go into purely Eastern medicine. My goal was always integration. My mother is a nurse and wanted me to go in the Western medicine route. And I just wasn't attracted to the Western medicine route, but I never negated it. So my belief is that the East and the West can really share a powerful unity if practiced in conjunction with each other. So I kind of cringe a little bit at the word alternative medicine. I see that acupuncture and Ayurveda is, in a way, the original medicine. And I think holistic medicine is probably a better word. And Shirley and I were talking a little bit about this before we went into the recording, but the power of the mind and the importance of our mind being involved in our treatment modalities. We have to believe that our treatments are doing something positive and good for our well-being. So the topic today is pretty broad. It's very open. What is Chinese medicine? What is acupuncture? I've been here for 3 years at Dragon Rises College of Oriental Medicine, trying to understand what that is. And still 3 years later, I'm scratching my head and trying to understand what this medicine is all about. I'm so happy and somewhat proud of where I've come from day one to here we are 3 years later. So a place to start with what is Chinese medicine or what is acupuncture? I think we all probably can conjure the image of the Yin Yang. The symbol beautifully depicts the nature of our medicine and how we develop treatment modalities through acupuncture, through herbalism, through nutrition, through even meditative practices like Tai Chi. So the Yin Yang, if you guys can imagine it, is a circle, and it has somewhat of a black snake and somewhat of a white snake that are kind of hugging each other. And there's the opposite color in the top and the bottom of those two snake-like swirling figures. And these are basically two poles of one continuum. So we have opposites. And Chinese medicine is purely allopathic in the sense of the word. We heal with the opposite quality. So yin must be met with yang, and yang must be met with yin. So what the heck is yin, and what is yang? So we could think of, let's start with yin. Yin is more of a feminine quality. It stores, it stabilizes, it supports, it forms more material foundations in our system. And what is yang? Yang is more subtle, it's more masculine. It is more of the movement and the energy and the velocity of things that are going through our system. And what we're trying to do is achieve a unique balance between these two forces. So yin must be balanced with yang, and then vice versa. And if we could all be healthy, that would be great, but that's just not the case in our human form. So as an acupuncturist, we're trying to find unique ways to harmonize these two polarities in the system of everybody. What is yin doing in this person's body? What is yang doing in this person's body? How can we strike a balance? So you have to be quite clever to be an acupuncturist. And this is the joy of going to an acupuncturist, is you don't have to think on that level. You can go and lay down, start to breathe deeply, and the acupuncturist, if they're good enough, can see what's going on, and they can apply the right points, and you can receive that. And if you've had acupuncture, you might find that when you get up and leave after a treatment, you feel light, you feel balanced, you feel even, you feel happy. And that experience should be a pivotal point in your healing process. So yin and yang has to be addressed initially with this. And what unites yin and yang? What keeps these things together? What is the movement of all these systems within our body and in our mind? And next we come to a term that many of you have heard before, but it's qi, which is energy, or we'll call life force, or we'll call vital force, or a life charge. But qi is one of the most fundamental aspects of this medicine, how to help the person circulate the qi through the system, how to allow the qi to be well cultivated in the system so we can be good charged. So the qi is basically the electricity that sustains our existence in our life. It's what keeps the heart rate going. It's what sends the blood through the cardiovascular system. It's what sends the food all the way through the digestive system and eliminates it. It's what inspires us. It's what charges us. So this qi is what unites the yin and the yang together. It's the movement between the continuum. It's the movement between these two poles. And we'll see that qi will warm us. Qi will transform. Qi will transport things. Qi will raise and hold things up in the system. And what we're doing with acupuncture is placing needles in various parts of the body that are good areas to, I don't like to say the word manipulate, but we could say manipulate the qi so it can start acting in a certain way. We're like electricians at a house. And instead of fiddling with switches on a wall, we're starting to manipulate points on the body that cause the qi to act in a certain way. Using the qi, we can find that the acupuncture points will start to awaken, or we could find the acupuncture points will start to sedate or resolve. And being clever in our treatments, we have to find ways to raise the energy and ways to lower the energy. So we can find, again, that harmony between yin and yang. So when we come to an acupuncture session, well, what could we expect? What are some things that we will likely experience, especially if you come here to the clinic at Dragon Rises? And it's very important. Again, as I was talking with Shirley today, this morning before the session, is the mind has to be involved. We have to feel felt and heard. You have to believe in it. And in order to believe in this medicine, we have to develop a sense of trust with the practitioner. And this is what's very unique with our system medicine, is we are able to spend a lot more time with each patient. And over the years, I've thought about what is healing, what is medicine, and I've basically wanted to come to an answer. It's not complete yet in my studies, but it's both a science and an art. It's a science and art of causing change, beneficial change, to occur in a person's life. So healing to me is the science and art of causing change, a positive and beneficial change, to occur in a person's life. So when someone comes in and sits down in front of us, we have to establish a sense of trust and compassion. So it starts there. Hello, how are you doing? And you should feel good in that person's presence, where you can feel open to discuss the things that you want to talk about and to address the physical problems, the energetic problems, and the mental emotional problems that might be manifesting in your pathology. So the first thing, we take a very rigorous medical history. We want to know how things were when you were born. How were things when your mother was pregnant with you? How was her health? What was the first 10 years of your life like? Did you have any sicknesses? Which child were you? Were you the first child? Were you the only child? Were you the middle of six? Were you the last of six? Where do you fall? How are your relationships with your parents and your siblings? Where did you grow up? Did you grow up somewhere really cold, like the Midwest, or did you grow up somewhere very hot, like Albuquerque, or somewhere here, like here in Florida? How many children do you have? How long have you been married? And we'll start to go through all these questions. And I very commonly find this with a lot of people that come here and they start to come to acupuncture for the first time, is that no doctor has ever asked me this many questions. And they start to feel heard. They start to feel seen. And I've noticed with certain patients that are hesitant in the beginning, they start to open up by the third session. They feel safe here. So the questioning really starts to paint a strong medical history of the individual. And we form a foundation. And the foundation has to be set, where we want to see where have you come from and where do you want to go? And we set a goal. And this is good because we as humans like to move in a direction. We want to see where we're going with this. Why should I come if this acupuncture isn't doing anything? Why should I take this very unusually tasting herb if it's not going to do anything for me? We want to see a good direction. So we give the treatment based on what we see in that initial intake, the initial concerns. And the initial treatment doesn't necessarily have to be a home run, those are always great to have. But basically, it's a cleaning out of the channels, a restructuring of your chi. And we start to see where the yin and yang is and how it's participating in your pathology. It's advised to make regular routine trips coming back to the clinic to have acupuncture. Some people come once a week. I would say most people do. Some people that are working on more intense pathology will come anywhere between 2 to 3 times a week. And in China, as I'm told, is sometimes they'll have 5 treatments a week. They're very consistent with their treatment. But the point is, returning to the clinic is important. And one thing I have found is people look forward to coming to the clinic. They look forward to talking to you. They're excited to come in for their acupuncture treatment. It's not so much like going to the dentist or to the doctor, where people usually go into the hospital or to a clinic somewhere and don't really have an overwhelming sense of excitement. People I find coming here to the clinic are excited. And as a side note, yes, acupuncture has treated high blood pressure quite well. I've seen that work wonders. And I'll get back to that here in a little bit. So the follow-up treatments are very important. We can start to form deeper connections with the person, and we start to see the changes of patterns. So a pattern is basically a snapshot of which organs are involved with our disorder. How is the chi functioning? How is your blood functioning? And we try to see the most severe and complicated aspects of your imbalance. And that's what we're addressing every week. So I've noticed certain times people come in with low back pain, and we resolve the low back pain. And then we've removed a layer, and then we get a little bit deeper with that person. We start to address things maybe on a digestive level. And then once the digestion improves, then we start to work on something that's more mental, emotional. And we start to talk about things that are more challenging in the mind. And I've noticed that you can't separate the body from the mind, or the mind from the body. And the thing that connects that is the energy. So coming back to another definition is, instead of calling it alternative, this is why I love the word holistic. We have to look at the person as a whole, a complete person, a complete unique expression of nature, which we are. And this is again why I think people are enamored with the Chinese medicine. They love coming. They love to have that feeling of health. And health, in terms of Chinese medicine, is that feeling of inspiration, feeling of excitement, feeling of moving through life with ease, able to look at the challenges that our existence has, and able to look at it with a sense of magnanimous qualities, courage, bravery, and also so we can be happy and free. And it's important to have that in life, because as we've seen in the past near 2 years, it's been very challenging, and we should be, and we should strive to be resilient. And I believe that acupuncture can truly support that. So coming back to what is Chinese medicine, and what is this approach? And I think that a big goal of what I would like to have today is to demystify what Chinese medicine is. And we've talked about what Yin and Yang is. We've discussed a little bit about what Qi is, and we've discussed a little bit about what your initial appointment and what follow-up appointments might look like, and who is it for. It's definitely for everybody, and I definitely want to encourage any and all of you to come here to the clinic to address anything that might be on your mind or in your body. Acupuncture is definitely for everyone. I have many patients that just like to come. We're not necessarily working on any serious problem. And I definitely have patients that are going through some severe pathology. The unique thing with both of them is that they make their weekly appointment. So I know that we were supposed to go a little longer before the Q&A, but I think what would help a little bit is as we go on, maybe take some notes and let me know if there's some questions. But before I kind of continue on, I would like to just open up a little bit and ask if there's any questions, any things that you guys are thinking about, and maybe I could address, and we can steer this conversation in a way that can address some things that you guys have been exploring in your classes, and or anything that's kind of come up in your mind. So any questions at this point? Okay, so the second question, thank you for that. The second question is a good one. So can you have acupuncture without taking herbs? And this is a good question, because when I started acupuncture, I remember one of the first terms is, well, traditionally, Chinese medicine was herbalism. And herbalism was almost a separate science in and of itself. And the ancient healers were plant healers, and they would primarily just use just healing modalities through nutrition and plants. And acupuncture was a side modality. So you would have, and they would almost kind of look down upon the acupuncturists. Well, this is a very long time ago, and times have changed. And in order to have a well-balanced clinic in modern acupuncture, the Ayurvedists is encouraged to learn both herbalism and acupuncture. So yes, a lot of acupuncturists are well-trained. And here in the state of Florida, we do have to pass our herb board. So a lot of patients here at the clinic are on both herbs and they're receiving acupuncture. But some people are hesitant with their herbal approach, and they won't take herbs just for personal reasons. So you can receive acupuncture without taking herbs, but you definitely can have acupuncture and take herbs. And then I'll add again, you can come just for an herbal formula and take just herbs.
Could I ask what kind of psychological counseling background you have?
Psychological counseling? So I am not a therapist or a counselor. I studied Ayurveda, and within Ayurveda, I studied Vedic astrology, and that could be, those are two big discussions that are apart from this. And I noticed that in the beginning, when I was doing Ayurveda, people would talk about digestive problems and doing as I was trained. And then without me asking, they started to open up about their personal lives. So counseling and psychiatry is not in our scope of practice. But when you're sitting with somebody for 2 hours, as we do here at the clinic, inevitably people will talk about their life, their partner, their husband, their family, and those things will come up. And a big part of acupuncture is a very strong psychological component, because we don't separate the mind from the body. So I think
you are providing a wonderful counseling experience for people. I think probably that's the basis for their return. The comfort of being allowed to express themselves and have someone sympathetic listening, someone caring. If you thought at the end of that you just gave them a back rub with positive thinking about how things could improve, would that be as good as acupuncture, or do you really think there is a value to the other part of it?
You know, it's a great question. And the founder of our school, Dr. Leon Hammer, is a psychiatrist, and he just celebrated his 97th birthday, and he's still writing material for our school and writing books, and very fascinating man, and very unique way of practicing. And he has a very strong influence on psychiatric medicine in the realm of acupuncture. And he wrote a book, and which is what our school is named after, is called Dragon Rises, Redbird Flies, which is basically the story of the phoenix in Western mythology. So you have to see where the patient is at. A lot of times people aren't willing to talk about some of the feelings and the emotions. They're a little bit more closed off. So I don't push a talk, but I don't push too much. And maybe they do want to just come for a little bit of acupuncture and a back rub, and then they're on their way. But you plant a little seed, and you say, I'm here. Just know that I'm here whenever you're ready. And we're in no hurry, but I'm here to help. And as time goes on, if the patient is willing, then they start to open and blossom like a flower. And we are beautiful beings of nature. And as someone connects with you and they start to feel the chi move, and that'll lead me into the next question from Alan, is talking about the meridians. They start to feel this mystical thing pass through them. It's like working out a muscle that we didn't know we had. Like, wow, what is this right here? This is a funny feeling. I feel like I can use this part of my body. So once the energy starts to move a little bit, then we feel inspired. We feel awake. We feel the charge. And then we might be able to talk more about some of the deeper problems that are going on that go beyond, a back rub. So the next question is very important, is the meridian. And I'm not one for battling over which word is better or not. I think that could be a little, gets a little too scholastic, but this little area I do enjoy a little bit more battling over a word. Our course here is called Meridians, but over the 3 years, for me personally, I enjoy using the word channel. So channel kind of depicts like a waterway, and a lot of the channels are related to water, and especially in some of the ancient spiritual text of China, you'll have a lot of references to water, be like water, move like water, and the observances of water. So the meridians, or the channels, are a network of pathways. The importance is a network of pathways that are interrelated, that create a coherent whole. There's a big bite right there. The channels are an interconnected network that create a coherent whole. And in that channel, the water, we have chi and blood that moves through. This chi and blood nourishes us, it charges us, it gives us health. So you can imagine when these meridians or these channels are congested with too much, or depleted with too little, or have toxicity in them or anything, then you're going to have chaos. You're going to have disorder. A great example is, I don't know how many of you have spent time in Manhattan, but if you go to the lower end of Manhattan, it's madness. The roads are going everywhere. You don't know right from left, up from down. It's just all a cluster. And then the developers said, well, we need to do something about this. And then they created the grid. And you're like, first and first, second and second, third and third, we start to have crossroads, and it starts to become more orderly. And we can go up and down, right and left. We know exactly where we are. So this is a good example, if we can use that mental image to think of the meridians, is we have these channels that move through the body, much like Manhattan, just as complex as Manhattan. And when we start to address these meridians through acupuncture needles, through taking herbs, these meridians start to act more coherently. They start to act more in line with what we need to do. The channels need to be maintained. And this is something that you can do daily, actually, just through deep breathing. Now that I won't cure all the problems, but if you can start to become aware, if you go to an acupuncturist and you find certain points that work well for you, every morning when you wake up, you can take some time to sit in a chair and take 10 deep breaths. And those 10 breaths will start to encourage the chi to move through the meridians, or the channels that you have. So the next question is from Terry. Which three?
If you don't mind, let's bounce back and forth from our hands as well. And then we'll go back to this chat. Ron Byrne, I see you disappeared, but if you're still there and you have your question?
I did have a question, and it was coming back a little bit to the mechanics, and I think you're starting to address it, Kyle, with the channels. When you do an acupuncture intervention, when you place a needle, you're trying to influence the balance and the flow of the chi. Is it a vein you're going into or a muscle, or where does the needle normally go?
Wonderful question, and I think this also highlights the colossity of this subject. What is Chinese medicine? And again, we can focus on where the needle goes for an entire hour. So, brilliant question, and this gives a creative integrity to the practitioner. How deep do they want to take this needle? So, coming back to the meridian, the meridian will flow superficially on the skin. It will flow minutely just below it, and then it can flow very deeply. So it can start very small. Usually the channels will start at the fingertips and at the toes, and the qi is very tiny. And as it moves up the limb and throughout the body, the qi will open up and it will start to be a little bit more specific, broad, and it will act in different ways. So depending on where you are on the body, this can get complex, is you want to needle things a little bit differently. So you're not going into a vein, and a lot of times the channel is just basically open spaces, or the points are basically open spaces in these unique areas along the line. So many times when I'm working with someone, and I will just take my arm and I'll move through where the channel is to just see how, if the muscle is flaccid, or if the skin is very tight, or if it's very bumpy, or if there's a lot of fluid, and I'll just kind of see where it is. I might massage it a little bit, but it's not necessarily a vein. It's not necessarily a muscle system. It's almost an etheric movement through that area. And if you've received acupuncture before, there's a famous point right here. You guys can massage it yourself if you want. A lot of times, if you have a headache, people will start to massage this part on their right here in the between the thumb and the index finger. I'll needle this point, and many patients who don't know anything about the channels will start to feel where there's this kind of a current that starts to move through the channel, and they'll actually talk about where they're feeling that that point. Yes, this to answer your question again, to reiterate, the channel can exist superficially. It can have something very deep, and it can be in between. It's not necessarily connected to a vessel per se, but it can influence those areas of the body, because the channels create a coherent whole. May I move on to Terry's
Yes,
question?
I just like to address, go back and forth so everyone feels heard.
Okay, wonderful. So 3 problems that respond best in my experience. And like I told you guys before I got into acupuncture and Chinese medicine, I was involved in Ayurveda. And like I was saying with Shirley, a lot of people were coming to me more for counsel, and I was happy with that, but I felt like I might be jumping out of my scope of practice. So I wanted to come for a more clinical experience. I wanted the power of the needles and the herbs to address problems, and I was very concerned with what that might be. So why do I want to do this? So the number one thing of the 3 would definitely be pain. Pain management is one of what I have found to be most fascinating in Chinese medicine. And there's many systems of how to address that. And we call it acupuncture technique, but there's been many different approaches to pain management. And it could be muscular, it could be joint pain, it could be digestive pain. But I would say that pain is the first condition. The next I've found, and why I particularly like this is because it was a big factor of mine in Ayurveda, would be digestive problems. So many people will get upset stomach and they deal with chronic nausea. Many people have endless constipation or endless diarrhea. Certain people have very queasy, uncontrolled gut. And I found that the combination of herbs and acupuncture have created a great sense in that. A patient recently, this comes back to highlighting the mind and the body, came a little bit ago, and I feel the pulse. We were doing the initial intake, and there's a quality called the husband-wife imbalance. And basically it indicates an interpersonal conflict. So I just said, is there anything that you're having trouble letting go of? Is there interpersonal conflict? And you recently go through a divorce or a breakup? And very closed off on day one. We weren't going to go into anything like that. I said, okay. She said, no, nothing that I can think of. Session 2, we find that she's retiring and children have left the house. And then session 3, we found that there is a breakup that she had 2 years ago, that she still has some dreams of the individual and still holds on a little bit. And I found that very interesting because the primary complaint was midsection distension and pain and holding on. And there was accumulation in the midsection. So our treatment was to relieve midsection congestion. We call it liver qi stagnation. But it was basically letting go, how to let go. So psychologically, we were dealing with letting go. And then physically, we're working on improving digestion and moving qi to go down. And she's experienced a decrease in bloating, a decrease in abdominal discomfort, and a little bit more range of motion and movement in the midsection. And the third of these, I have to say, it kind of is in line with pain, but and I'll tie this in with another condition, but it's basically headaches and gynecological issues. So headaches is a big factor that I work with, and many people can see a reduction in the frequency of migraines and headaches, and then a reduction in the severity of the headaches. But so those are the top 3, but I like to say to all people that I love working with maintenance. I love working with mental emotional conditions like depression and anxiety. I like to work with insomnia, and again, reiterating pain, headache, and digestion.
Let's go to Paul Parker, if you don't mind. Paul, do you want to unmute and ask your question?
Yes, I'm wondering whether there is a close connection between massage therapy and the holistic integrative approach that you're talking about. It is regarded, I think I mentioned to you earlier that I had lived and worked in Indonesia for 5 years, and where massage therapy is just another one of the therapies with acupuncture, acupressure, and many other kinds of things you're describing is the normal way you get attention for a medical problem.
Yes, I agree. We take a full 15-week course here on Chinese massage, what is called Tui Na. So Chinese massage could be an entire course in and of itself, which goes much longer than just 15 weeks. And certain people definitely have more of an attraction and affinity to work more with massage. But yes, massage can play a very large factor in this. And there's many practitioners here in Gainesville that, one in particular in my mind, that will use manipulations and massage in conjunction with her treatments with the needles.
Yes.
So yes, I think massage is a great benefit. yes, very much in favor of that. Let's see, how were the meridians discovered? And that's that's a very good question, and that's something I'm still trying to find personally. There's myth and there's legend, but most likely what happened was Chinese medicine evolved out of a very rural shamanic type tradition, and they were using reflections in nature to treat the physical body. So a lot of this was hit and miss. There are the stories of someone has a neck pain and they hurt their ankle and their neck pain went away, but now their ankle hurts. So a lot of how the meridians were discovered was through, I would say, deep meditation practices with some of the early practitioners, and that evolved into a new generation. And it was experimentation. It was reflection on what works and what doesn't work. It was through anatomy, people pulling after someone deceases, observing the body. And over thousands of years, with small refinements, they're able to find that these meridians were for real, and how they were connected. So it's hard for us to imagine what 1,000 years can do to one system of medicine, and let alone 4,000 to 5,000 years for the totality of this medicine. So big question. And it's probably multiple factors of how these meridians, these channels were discovered. What did the needles actually do? So how were the meridians discovered, and what is qi? How do we know that it's doing this? You could definitely examine NCBI, WebMD, and find many studies on acupuncture treating particular symptoms and conditions. And the hard thing is everybody is unique. So when we take one acupuncture point, not everybody needs large intestine 4 needle. So it's hard to say scientifically what's going to happen when everybody's needled in that one point. So it's very dynamic. It's because everybody is unique. So it's hard to say 10 people have a headache, and we gave all 10 people the same treatment, and therefore they all reacted the same way. Now, everybody has a unique headache. Everybody has, just like they have a unique body, so they require a unique treatment. So the needle goes in, and it provides a sensation. You respond to that. Your body, your mind, and your energy respond to that treatment. So just like when you get a massage, you might find that there's some congestion in the back, a lump of your muscle, something stiff, something hard. And the practitioner comes to that point and starts to push into that. And you find that you have relief of that pain. So a needle works in the same way, where it's much more subtle, but the needle goes in and there's a response. And that response, your body starts to react differently. And it's usually a connection from the central nervous system, the brain responding to that area. Are there scientific articles showing benefits for specific conditions such as neck pain? Yes, but again, this highlights the challenge of not all neck pain is the same. Not all treatments are going to be the same. So when we have something like a particular drug using for a particular disorder, we could say 95% of people that use this experience that. That's hard to achieve in acupuncture, since not everybody is going to be treated the same way. And then I definitely want to answer this question, because my background initially as a kid was music. So is there a role for music in acupuncture? And ever since being a child, I wanted to be a musician. And I was fortunate to go to a performing arts high school in Jacksonville, and music played a big role in my life, and that was definitely a great and healthy escape for me. So I play guitar. I've been playing guitar since I was a little kid, and went to Douglas Anderson School of the Arts, and that was a great place for me. And it's a little challenging to play music here because we have a bay of 4 different treatment facilities, and we're not set up for music. But when I set up my own clinic, then I fully intend of playing music, and sound has an enormous impact on us. And definitely, I encourage everybody to listen to more music.
Are you going to set up your clinic locally?
The plan is to be in Jacksonville.
Ah,
So the plan is,
we're
but
going back to Douglas Anderson.
yeah. I actually went back and substituted there some time ago. It was neat to see.
I have a question. This is Pushpa. When you say that acupuncture works for several different medical conditions, does it work for metabolic conditions such as, say, diabetes or obesity, for which we do have pharmaceutical interventions? So do you treat things like that with acupuncture?
Good question, and this comes back to the importance of the acupuncturist should be in a way I get a counselor in a way, where, or a life coach, where receiving needles may have a change in someone's blood sugar, but it won't take away the problems entirely. So as being a coach, we have to encourage a person saying, if we would like for it to see you walk a brisk walk 20 minutes twice a day, morning and evening time. Can we work with the diet and reduce sugar intake? I have a formula that I would like for you to take multiple times a day that will help with blood sugar regulation. These treatments are geared for moving stuck waste and improving the quality of what we call spleen qi, which is closely associated with the pancreas. So yes, we can treat these things, but a big part of this is the will of the patient, and a lot of that we have to inspire into the individual. If they would like to lose some weight, a lot of that comes into their will, and we have, as practitioners, is to inspire that, and to have someone feel awake and excited, and to achieve a goal and to move towards a goal, and not to feel like a victim or wrong because they have to deal with an imbalance. So yes, my mother was a diabetic, I guess you could call a specialist, but she was a nurse in Jacksonville, and she did a great job. She had a lot of people that wouldn't listen to her, and there were very challenging cases. And then when they went blind or they lost a limb, then they started coming to her and discussing and opening and changing. And she's changed a lot of people's lives. And she was did a great work at the VA in Jacksonville. She's retired now, but she did a lot of stuff. And yeah, she still misses it, but she had a great time over there at the VA for many years.
Could I ask a question?
Some questions in the chat.
Is a physician referral needed for treatment, insurance coverage? Good question. And then Terry, again, imagine needling someone who is obese is less effective in needling someone who's thin. So I'll go with, that's pretty easy to answer, is no, I wouldn't say that. Obese is, we find the right points for the right person. So we want to definitely activate the qi. We want someone to have a response. And despite someone being obese, I've had people that are very overweight and have had great response to treatment. And I've had people that are very thin also have great response to treatment. Now, you just have to find the right way of needling. There's no need for a referral to come to an acupuncturist. In Florida, we can be considered primary care providers, and we can, if we choose so, receive insurance. We don't take insurance here at the college, but there are many acupuncturists that do take insurance.
We have a question here in your room. Go ahead.
I have a question. How many stations or needles do you start with a patient that comes to you?
How many stations of needles do you start with?
Yeah. How many places, how many stations on one's body do you start with?
Is the question how many needles are used?
Yeah.
Okay. So a lot of different, again, coming back to music, there's a lot of different ways to play the guitar. There are minimalists that are very simple, and then there's people that are very virtuosic and will play many notes in a very small period of time. So it depends on the practitioner. I've seen very highly skilled practitioners that will use anywhere between 12 and 30. I've seen up to 40. And I've seen people use 4. So I am somewhere along the lines of liking to use 6 to 12. And if somebody is coming to get acupuncture for the first time, I probably would like to stay somewhere around 8. There's no need to put the finger into the electrical socket and go for the max on day 1. We need to ease into this, and consistency is very important coming to regular treatments, and being patient. The patient should be patient. And as the patient is being patient, then the change happens. So I like the minimal approach. Less is more. And if this point's going to do something like it says in the classical text, then I need to believe in it. And if this point is going to take care of headaches, then I trust it and I believe it, rather than having to overwhelm the person with too many points.
I have another question here. The question was, can acupuncture help with balance and possibly maybe the effects of a stroke?
Yes. Is that the question? Is stroke and balance? Yeah. One of the, my initial meditation teacher in Jacksonville was an acupuncturist, and he's been practicing for close to 50 years now. He lives up in Virginia now. And what fascinated me and also irritated me, because I was an Ayurvedist at the time, and I wasn't able to treat people with post-stroke paralysis. And he was getting really amazing results with acupuncture with facial paralysis. Not 100%, but he was getting, from Bell's palsy, he was getting some pretty dramatic results just with acupuncture alone. So yes, if you're consistent, there can be a restoration of balance. There can be changes in Bell's palsy. 100%, it's all about timing. There might be a little bit there, but if you're compromised by 70% and you get a 40% reduction, that's something substantial. So I have seen improvement with balance, and I have seen improvement with paralysis. And there is both acupuncture and herbs for that.
Thank you. Are there any more questions?
I have a question.
Just I can explain. Is there anything that does not respond to acupuncture? Any medical condition that you know of?
Well, I mean, that's a good question. I think we should strive to see what doesn't work. Someone says this doesn't work, and it's like, well, let's see if it does or not, and let's go for it. And I am not in favor of Western medicine is evil and Eastern medicine is saving everything. My mother had pancreatitis about 5 years ago. After she had some gallstones removed, the surgeon perforated some tissue, And it was a pretty strong reaction. So in the middle of the night, she's freaking out, and I happened to be staying at their home at the time, and we were heading straight to the emergency room, and they took care of her quite well. I wouldn't be say, okay, rest and breathe deeply and let me put some needles in and just calm, we'll let this pass. So she was like, no, I need strong pain medication and I need to be at the hospital. So very grateful for that. But on the flip side, there's many things that us as acupuncturists can do that Western medicine seems to be clueless on. So we need to find somewhere in the middle, and integration is the way to go. And I think as I've seen changes over the past 15 years, being in alternative healthcare, I've seen a lot of changes. And people are seeing the integrative approach being very successful. And that's more of my path.
Shirley?
And my question was really about, as you're following a patient and you see pathology beyond which you're able to deal with, do you manage to convince the person to go a different route, to take care of tumor growth or things that you discover can't be treated with your acupuncture? How do you manage that?
Oh, we are, from day one, we are told not to be shy with referrals. You know, for patients, it's good to know that it's good to stay with one practitioner, in my opinion, and just work with acupuncture. And but also, if you are working with something like cancer or that's pretty severe, it's encouraged to go both and be, again, integrative. And if someone says, no, I just want to do this just with acupuncture, I am very much in line of saying, no, I think we can do this with integrative approaches. I can help you with nausea that you might have from treatment, and let's be very supportive of this with both of your Western and Eastern approaches. There may be people out there that have a high success rate on treating people, but I'm not aware of them. And personally, I don't have those numbers of saying I've treated this many people with this type of cancer and have had this much success. That's just not in my arsenal. So I'm reluctant to say that I treat people with very strong disorders. And plus, cancer is out of the scope of practice for us as acupuncturists. So again, answering the question, integrative is the way to go.
Wonderful lecture. Please, good luck in your practice, and
yes,
good luck to that 97-year-old leader, Dr. Hammond, is it?
Yes, yeah, fascinating man. Yeah.
Thank you very much. I think, are there any other raised hands? No. Okay, Kyle, thank you so much. We really appreciate you.
Thank you. Thank you.
Thank you.
Lecture, and we wish you all the luck.
Thank you.
Start your practice in Jacksonville.
Wonderful.
Keep in touch.
See you in
with us.
Jacksonville.
Jacksonville.
Yeah. You guys have a great day. Thank you very much.
Bye-bye.